So today, I'm very, very happy to talk about a topic that is one of my preferred topics. It's about supplements, and supplements are very, very widely used by many people, including people with arthritis. Um, I don't know if you had the chance to meet me or to know anything about me, but I'm going to tell you I'm going to introduce myself just briefly. I'm a physician. I'm US board certified in internal medicine and rheumatology. I have a doctorate in immunology, and I have completed a few postdoctoral fellowships at Harvard, at University of Pittsburgh, and then I completed my rheumatology fellowship here in the United States at University of Cincinnati. Over the years, I got passionate about lifestyle medicine, and I pursue a couple of courses, one in nutrition science from Stanford University and another course from University of Massachusetts. And not only that, but I'm a mother of 3 kids, and I'm a wife, I'm a daughter, I'm a patient. So I do wear many hats. And today we're gonna talk about the 5 best supplements that I consider to be important for people with arthritis. And as you probably know, supplements, they are on the market for many years. And this industry of supplements is a big industry. If you look at the global supplement market size, it's about $151 billion just in 2021. But this is expected to increase over the years. And just in the United States, about 6% of this amount is represented from the money that people are spending here in the United States. And the question is, and I would like you to answer these questions, but since you want to be or remain quiet, the question is, what are supplements? And the answer is that they are natural or synthetic products that are marketed to supplement your diet for optimal health results. And they could be represented by vitamins, minerals, herbs, amino acids, enzymes, organ tissues, extracts, or concentrates. And they can come in many forms, from tablets to capsule to soft gels to liquids, and obviously powders. And about 25 years ago was the first time when somebody regulated this industry. In 1994, the American Congress passed a Dietary Supplement Health and Education Act, which actually defined what are supplements and characterize them as food, but not drugs. So this is very important for you to understand that these are not medication. They don't pass the scrutiny of medication. And those that are producing these supplements are responsible to make sure that they are safe when they are marketed, but they do not require approval from the Food and Drug Administration. And although you see on the bottles that they can treat or prevent or cure specific diseases, they should not claim that. Manufacturers of supplements should not claim that these are able to treat, prevent, or cure specific diseases. Why it's important to know about supplements in patients with arthritis is that arthritis is a disease, an epidemic disease that in the United States affects 1 in 4 adults. Actually, 1 in 4 adults in the United States, they carry a diagnosis of arthritis. And if you look at this graph over time, it is projected that the number of patients with arthritis will continue to increase. And just in 2020, there were predicted to be about 63 million people with arthritis. And there are many forms of arthritis. You probably know that there is osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, or psoriatic arthritis. So it's important to know when these supplements are important to be taken, and it's also important to understand why these supplements are good for certain types of arthritis. You probably know a lot about the osteoarthritis, which is the wear and tear arthritis, the arthritis that affects the knees, the hips, and sometimes the thumbs. But it's also important to know about other forms of arthritis like rheumatoid arthritis, that is an autoimmune disease, an autoimmune form of arthritis, an inflammatory type of arthritis that can lead to a lot of deformities, and those patients um, will lose their function of their joints because of ongoing inflammation. We'll talk a little bit later more about rheumatoid arthritis. But the question is, what are the best supplements for arthritis and why are they the best? And I'm going to start this, this presentation was talking about collagen, which is actually, collagen is the most abundant protein that we have in our body. It can be found in the bones, the skin, the muscles, tendons, and cartilage, and is the substance or the protein that makes our tissue strong and allow us to stretch. But as we age, our body will slow the production of collagen, and those networks of collagen in our skin that were initially tightly organized, they become unorganized. And if it's easy for you to understand, you look at your skin as we age, our skin is not so soft as it used to be. And collagen supplements are actually the top selling products in the market of these supplements for arthritis. And they are advertised to be beneficial for your skin, for your nails, for your bones. And they are sold either as a powder or as a capsule. And they are sold as peptides or hydrolyzed collagen, which are actually some broken down forms of collagen that are supposed to be easily to be absorbed. Collagen products are studied or were studied a lot for patients with osteoarthritis. And there are studies that I'm going to present, this study from 2006 that shows that collagen hydrolysate actually showed to improve the pain scores and the physical function of the joints. There are other studies. This is a more recent study published in 2020 that showed that collagen actually improved the pain on patients that were taking multiple types of supplements. And that is not only short term, if you take it less than 3 months, but also in the medium term, if you take it for about 6 months. And not only that it's going to reduce the pain, but this study also shown that taking a supplement with collagen will improve the function of your joints. On top of that, patients will ask me, besides taking supplements, can I take my collagen from foods? And the answer is yes. You can find a lot of collagen in brisket, bone broth, in gelatin, in pot roast, and actually in fish. But be advised that this collagen that is embedded in all these foods will be broken down into small amino acids by your stomach, and it's going to get where it needs to be getting. The second supplement that is widely used by patients with arthritis, and especially osteoarthritis, is the combination of glucosamine and chondroitin, or you can see them sold separately as well. And both glucosamine, but also chondroitin, are actually normal components of our cartilage tissue. And it was shown that in patients with osteoarthritis or the wear and tear arthritis, they are depleted. That means that the bone does not contain enough glucosamine or chondroitin, or the cartilage does not contain enough of that. But their benefit in patients with arthritis is very controversial. And I'm going to explain you why. Many people are talking about the fact that the dose is important, how much you take. For example, many studies, they recommend to take glucosamine about 1,500 milligrams per day, or chondroitin 800 milligrams per day. Another study said that actually is the brand that it matters. This is actually a meta-analysis that collected data from about 25 trials, and they looked to about 3,000 patients, and they show that glucosamine moderately reduced pain, but these results were dependent on the brand of the glucosamine that the patient takes. And some of these studies contain this brand from Rotafarm that was shown to have the benefit. There is also debate about the type of chondroitin that you take, and one pharmaceutical company ran a study that actually showed in 2017 that patients with wear and tear arthritis, knee wear and tear arthritis, that took 800 milligrams of chondroitin actually had a superior effect compared to placebo, but that effect was actually similar to anti-inflammatory medication like colecoxib in reducing the pain and improving the function in 6 months. So the debate is still ongoing, and there are studies that also shown that there is just minimal effect in patients with osteoarthritis of the knee and the hip, and some are saying that if you take it long enough, let's say for about 2 to 3 years, that may result in a delay of the progression of the knee arthritis. And these are just a few studies that I put here that they show that if you take chondroitin or glucosamine or the combination of those two for about 2 to 3 years, you might have a chance to reduce the decline in your joints. This is a very important study published in New England Journal of Medicine, which is kind of the ultimate goal for any researchers to get to publish a study in New England Journal of Medicine. And this study was run in patients with knee osteoarthritis. They get to these patients either chondroitin or glucosamine in the doses that are listed here. But they also compare those and the combination of those with an anti-inflammatory medication, and they look to see if in 6 months the pain in the knees of these patients will decrease with about 20%. And actually what they have seen is that when patients use glucosamine or chondroitin alone or in combination, when they look to the general population, they did not see any differences actually compared to placebo or compared to an anti-inflammatory medication. But in certain patients, the patients that they had moderate to severe pain, in those patients, actually, they have seen that the combination of glucosamine and chondroitin was actually effective, and it reduced the pain of those patients with knee arthritis. This is actually a more recent study. It's called the MOVE trial, where they try to compare the chondroitin and glucosamine with anti-inflammatory medication. And they have seen that actually their effect is very comparable with anti-inflammatory medication. So if you take this medication, it will reduce the pain, the stiffness, the functional limitation, the joint swelling, and the effusion after about 6 months. And they do have a good safety profile, which means that they don't cause severe side effects or side effects like anti-inflammatory medication will cause. Now, the next supplement that I'm going to talk about is called turmeric. You probably all heard about turmeric. It is also called curcuma longa. It is also called the golden spice, and it's very well known by certain culture for the anti-inflammatory, antimicrobial, and anti-cancer effects. There are many studies about turmeric. I was able to identify more than 10,000 studies about turmeric. and more than 120 clinical trials. And what interests me is the effect of curcumin or turmeric to modulate our immune system. And it's very important to know that, because it seems to me that those researchers were able to show that turmeric will influence not only cells that are in our cartilages, like these cells, synovites or chondrocytes, or osteoclasts, that are cells that you find them in the bones, but also cells that are in our immune system, are part of our immune system, like macrophages or neutrophils or lymphocytes. This is very important because in this way, we can understand why turmeric can have an impact on autoimmune diseases or inflammatory type of arthritis. If you remember the study about collagen, this is the same study that was published in 2020, and they look at different types of supplements that patients with arthritis or osteoarthritis will take. And like collagen, curcuma longa extract, it has a favorable effect. And that's not only in the short term, like if you take it less than 3 months, but also in the long-term run. Now, this type of supplement, curcuma longa extract, was also studied in patients with knee osteoarthritis, where they documented that those patients had synovitis. And they used this study where they randomly assigned patients to receive either curcuma longa, 1,000 milligram every day, or placebo. And after taking curcuma longa extract for 3 months, those patients had a greater reduction in their pain when compared to placebo. It didn't change,
1,000 milligrams a
but
day.
the pain was significantly decreased.
Is it
Now, this is another
3
study
months
that
on
compare how
and
safe and
placebo
how
and 1,000
efficacious
milligrams a
is
day?
curcuma longa in patients with osteoarthritis. This is actually
Yeah.
a meta-analysis which
And
pulled the
osteoarthritis
data
needs
from
back?
multiple studies, 15 randomized controlled trials, about 1,600 patients with osteoarthritis, and they give to these patients between 1.5 and 2 grams of curcumin extract, and they've seen that actually it decreased the pain level. But not only that, the effect was very similar with the patients that received an anti-inflammatory medication, but without the side effects. As you probably know, or when your doctor
1,000
is
milligrams
introducing
a
you
day.
to anti-inflammatory medication, they will tell you about the multiple side effects of anti-inflammatory medication like ibuprofen or Advil or naproxen. They can cause heartburns, they can cause ulceration to your stomach, they can cause liver or kidney damage.
Actually,
But more than
1,500 to
that, they
2,000
can increase
up
your
to.
cardiovascular
I
risk.
definitely need
So
upside.
taking a natural product without these
Majority
side
of the
effects
amount,
will have
but not so crippled.
great benefit.
Hey, I'm gonna track,
But
but I
how
don't
about
think I'm taking
patients
that
with
much.
rheumatoid arthritis? These are a few
But I
studies that I
definitely,
was able to find
I'll
that
definitely need the
show that if
maximum
you
because
take
pain is
turmeric for more than 90 days, it's going to help you to reduce the pain, it's going to decrease the markers of inflammation, and it will improve your disease activity, which means that you're going to have less active disease. But how much turmeric is enough? And the data that I'm able to find is between 1 and 2 grams per day. But it's also important to associate turmeric with black pepper, which will enhance the absorption of this supplement. Now I'm going to talk about another very, very common supplement that you find it everywhere on the market. It's called fish oil. And fish oil is very popular. It's actually sold for the market, it's about 12 million in 2021, and it is expected to increase to $17 million in 2028. And you probably are aware about the benefits of fish oil for patients that have cholesterol issues or triglycerides issues, or they have increased cardiovascular disease. But have you heard about fish oil to be used for arthritis? And this is the reason that the fish oil will work. Fish oil contains a lot of omega-3 fatty acids, which are known to produce other substrates that will block or will stop an enzyme called COX-2. This is the enzyme that the anti-inflammatory medication will inhibit, and in this way, they will decrease the inflammation. More than that, fish oil or omega-3s will impact your markers of inflammation. So those are studies that will show that if you take fish oil, the TNF-alpha, C-reactive protein, or IL-6, those are all molecules involved in inflammatory processes. If you take fish oil, these markers of inflammation will decrease. And these are studies that prove that. But how about fish oil and rheumatoid arthritis? I want to remind you about rheumatoid arthritis. For those of you that do not know what it is, it's an autoimmune disease that can affect multiple joints, especially the hands and the feet, but it can affect other joints. And it can cause a lot of inflammation, a lot of swelling, a lot of pain. And if you let this disease untreated, those patients will develop deformities, will lose their joint function, and many times will become disabled. And obviously, their quality of life will decrease significantly. And fish oil in patients with rheumatoid arthritis, it was proven to decrease the time of morning stiffness, because many of these patients will wake up with a lot of stiffness, will wake up with swelling. So taking a supplement with fish oil, it was demonstrated to decrease the time of morning stiffness, decrease the number of tender and swollen joints, and it will decrease the level of general pain. And very important for patients with inflammatory arthritis is that it's proven to reduce fatigue or tiredness. Many patients with rheumatoid arthritis will complain of being fatigued, very tired, and that's because of ongoing inflammation. And on top of that, fish oil will decrease the use of non-steroidal anti-inflammatory medication, Advil, ibuprofen, naproxen. All of these are anti-inflammatory medication that many patients with inflammatory arthritis will use. This is a study that actually is fascinating because they took patients with new onset rheumatoid arthritis and they added fish oil to the standard triple therapy that we all use. When I say we, it's all the rheumatologists will use for patients with rheumatoid arthritis. And what they've shown is that patients that associated fish oil on top of the standard therapy were more likely to get into remission faster and their disease was better controlled. So I do recommend fish oil to my patients in patients that are appropriate to get fish oil. And I do consider that fish oil can be regarded as a part of the standard therapy for rheumatoid arthritis. But not only in rheumatoid arthritis, fish oil was proven to be beneficial, but also in patients with lupus, ankylosing spondylitis, or other types of inflammatory arthritis. What I found fascinating is that fish oil is very good for patients with back pain. And this study that was published in 2006 looked at patients that they didn't necessarily require a back surgery. So they had back pain. They were using anti-inflammatory medication, but those patients that had added fish oil 1.2 to 2.4 grams in 4 months, 60% of those patients stopped taking anti-inflammatory medication. 60% of them improved in their level of pain, and 88% said that they will continue the therapy with fish oil. And what is very significant to report is that these patients did not have side effects from this supplement, which is absolutely great. Again, remember the side effects of anti-inflammatory medication. But is fish oil good for osteoarthritis, for the wear and tear arthritis? Here, the results are very conflicting, and it is not recommended to use fish oil only for this reason. You may have many other health benefits from using fish oil, but not necessarily osteoarthritis. And my patients will also ask me, can I get omega-3s, omega-3s fatty acids from foods? And my answer is yes. There are many, many foods that will contain omega-3s. And I just selected here a few, like pumpkin seeds, flaxseed and flaxseed oil, soybeans, walnuts, the cold pressed unfiltered olive oil, sardines, and eggs that are laid by hens fed on omega-3 diet, and algae. They do contain omega-3, which is very, very powerful for your inflammation, to reduce your inflammation. So how much is enough to take? And the recommendations are between 2.5 and 4 grams. And this is a dose that is approved by the FDA. And, in the past, there were many patients that will be concerned about side effects, increased risk of bleeding with fish oil. If they were taking a medication that was supposed to be, to prevent blood clotting, if they take fish oil, they were afraid that that will increase the risk of bleeding. But actually, this study that was just published in 2020 did not show an increased risk for bleeding with this dose, up to 4 grams per day. Now, the last supplement that I'm going to talk about, it's called vitamin D. And probably all of you are familiar with vitamin D and the power of vitamin D. But the question is vitamin D good for autoimmune disease? Is vitamin D good for arthritis? As you all know, vitamin D play an important role in bone and cartilage metabolism. But just recently, researchers find out that vitamin D has some receptors on the immune system cells. And that's why we started to connect the vitamin D with the immune system. Vitamin D can modulate the function of certain cells in our immune system and will decrease the production of pro-inflammatory cytokines. And vitamin D receptors are also found on cells that we have in our joints. And it was shown that if you are deficient in vitamin D, that will actually increase the risk for autoimmune diseases. And that started to be shown first in animal models. And more, we find out that certain things are applicable to humans. How about vitamin D deficiency and osteoarthritis? Although initially there were some studies, one published in 1996, that showed that if you have a low vitamin D, you will have an increased risk for osteoarthritis of the knees. In 2007, there were other studies that did not show that being low in vitamin D will cause you worse arthritis of the knee. One study that I found absolutely great was about vitamin D deficiency in patients with rheumatoid arthritis. This is a study that was actually published in 2004 that followed 20,000 females over 11 years. And those females were between 55 and 69 years old. And they've shown that those females that were this age, if they took a higher vitamin D, they had a decreased risk to develop rheumatoid arthritis. And this is a study that was just published in 2022, which actually linked the vitamin D and omega-3 supplementation with decreased risk for autoimmune disease. We all know in rheumatology that patients with autoimmune diseases, they have many times a low vitamin D level or low omega-3 levels unless they supplement it. And we all know that this is probably one of the causes of their autoimmune system not to run properly. But this study, which was randomized, double-blinded, placebo-controlled, the creme de la creme of the studies, it was done in 25,000 people. And they initially sought to look for effect of vitamin D and omega-3 fatty acids on different types of cancer or cardiovascular disease. They follow these patients for about 5.3 years. And they have seen that those patients that receive vitamin D supplementation, they actually had a 22% reduction in the risk to develop autoimmune diseases. And on top of that, some patients that they were taking fish oil, they had 15% reduction risk to develop autoimmune diseases. Now, let's talk about the doses of vitamin D and fish oil that they recommend. So in order to reduce the risk of autoimmune diseases, in patients that are more than 50 years old, they use 2,000 units of vitamin D per day and 1,000 milligrams of omega-3 fatty acids per day. So I know that probably some of you are interested to take supplements, and maybe some of you are taking supplements, but I strongly recommend you, before you start any supplement, to discuss your clinical situation with a physician that will be able to address all the risks and benefits of taking a supplement. This is extremely important because as you can see, some of the supplements can act like anti-inflammatory, and some of the supplements can actually impact some of the medication that you are taking. For example, if you take fish oil, that could decrease the absorption or certain medication. So you have to know, or your doctor has to know, what kind of supplements are you taking, and he will be able, or she will be able, to advise you further. Now, I would like to introduce you to this course that I have put together over the last year. This is a course where I started to introduce everything that I teach to my patients, nutrition-wise, mindfulness, but also exercise. And those lessons that I'm giving to my patients are extremely valuable to manage your inflammatory arthritis. And I partnered with two amazing people. One is Dr. Melissa Kale, which is a physical therapist and a board-certified orthopedic clinical specialist, and Dr. Elena Pradescu, who introduces people to a lot of techniques that are very, very powerful in managing pain that is coming from arthritis. And we do have this course. We plan the course over the period of about 8 weeks. You can see the lectures in your own time, but the lectures were structured to be to deliver you whatever mindset you have to have when you approach your arthritis, your pain. It will teach you everything that you have to know about what's the proper nutrition, what are the proper supplements. But not only that, it's going to make you a nutrition plan, a nutrition action plan. It's going to teach you how to manage pain using mindfulness. It's going to teach you how to exercise and what kind of exercises are appropriate for your disease. And it's going to teach you how to sleep better, because sleep is very well linked to increased amount of pain. And not only that, but we offer a lot of planning for you. You're going to have not only the resources available and the science behind those recommendations, but you're also going to have a plan done for a week, for a day, for a week, for a month, and you're going to have resources about what food you should have when you go to buy your food. We do offer you today a discounted price of this course of about 60%. You can use this coupon WEB60 to buy the course if you're interested. But our best interest is to see you in this journey and to see you in this transformation and to see you smile.